It's Jessica with Balanced Approach Counseling, and today we're going to be talking about trauma. So this video does come with the trigger warning for anyone in recovery of a trauma. It's okay if you're not in the place to watch this video, because we want to be mindful of any and all triggers. But before you exit this video, I want you to know that I see you, and that I'm proud of you for surviving. I'm proud of you for getting up and eating something today. I'm proud of you for healing and choosing to go to battle every day. You are so incredibly strong, and I know you don't feel that way. That thing, person, or event that hurt you and changed your life forever, it didn't make you stronger because your strength was already there. You survived. You did that. Keep going. If you need extra help, that's okay too. It's part of the process. We weren't meant to carry the weight of trauma alone. So I have linked some resources in the description below. So what is defined as trauma, you ask? Well, the American Psychological Association defines it as an emotional response to a terrible event, such as an accident, natural disaster, rape, war, domestic violence, among others. You can experience a trauma response to any event you find physically or emotionally threatening or harmful. As a therapist, I don't judge the trauma based on the event, which is to say, I don't look at child abuse and rate it lower or higher than any other trauma. I look at the emotional impact it has had on your life. You can drown in 5 feet of water the same as if you can drown in 100 feet of water. Whatever the situation or event was, if it impacted your life in a negative way, then your feelings are always valid. When dealing with individuals who suffered trauma, I often hear them questioning their own experience and emotions. They say things like, "Oh, why am I feeling this way? Am I crazy or overreacting?" Nope, not at all. You're responding to deep psychological wounds. We wouldn't respond to someone who had just been shot with, "Why are you screaming?" It was just a tiny bullet hole. It's fascinating to me how easily we dismiss psychological wounds, both in others and in ourselves. We have to acknowledge a wound before we begin to heal it. A traumatized person can feel a range of emotions, and they differ greatly from person to person, but some common symptoms are feeling overwhelmed, helpless, in shock, anger, fear, shame, guilt, anxiety, and depression, and these are just to name a few. Trauma can also cause physical symptoms, lack of sleep, nightmares, flashbacks, stomach aches, headaches, and even extreme fatigue. In my professional opinion, the most insidious symptoms are self-blame and shame, especially in cases of rape, domestic violence, and childhood trauma, because it's a barrier for individuals to seek help. If this is you, it's not your fault, and the shame belongs one place and one place only, and that is with your abuser. Let's put it back where it belongs. There are certain diagnoses that we look at when dealing with trauma. For the purpose of this video, I will be looking at the most common: PTSD, or post-traumatic stress disorder, along with complex PTSD. The first can develop after one traumatic event, and the latter with multiple exposure over time to many traumatic events. Many children from abusive homes carry the diagnosis of complex PTSD. This one breaks my heart because it's almost 100% preventable if parents would go to therapy and deal with the unresolved trauma in their own life. When you begin your journey to heal yourself, you are healing not only yourself, but now you'll have healthy relationships with people in your life. Healing is contagious, so let's begin to normalize and prioritize mental health. There's also something called secondary trauma, which is very important to highlight this because it affects families and friends of victims. These are the individuals who've experienced trauma secondhand. Also, many first responders can experience this as well. The cop who showed up to the scene after the murder, the nurses and doctors that witnessed the death of many COVID patients and watched their family members grieve, the veteran's wife who witnessed her husband's nightmares and flashbacks. You get the picture. Even therapists can experience secondary trauma symptoms, so we need to be self-aware and take care of ourselves when the situation warrants it. Let's talk about specialized treatment for trauma. You want to find yourself a trauma-trained therapist. I myself am trained in cognitive behavioral therapy with a focus in trauma. CBT is a modality that explores how our mind, behavior, and feelings are intricately connected to one another. This modality can help us navigate the wreckage of trauma and help align our thoughts and feelings. Now, I'm going to highlight another treatment here, even though I'm not trained in it. It's called EMDR. There are therapists out there who specialize in this, and it's also been proven to be highly effective in treating trauma. So my suggestion is do your own research and find a competent, compassionate therapist. I want you to find a therapist who is honored to hear your story, who knows how to sit with you in your pain, and who gently holds space for your healing. You may think I'm just talking about myself here. And while yes, I do these things, I know of many people in my field who are equally equipped. And I encourage you to find that therapist in your state, your town, or your neighborhood. Don't stop looking and don't give up on healing. Your future awaits.